Can we discuss mast cell disorder according to Ayurveda? Can you please elaborate on that? Yes, please. Go ahead.
Namaste, Dr. Ji. This case is about a 9-year-old boy. He has this. Whenever he gets the episodes, his swelling comes on the face, on his tongue, and there's itching on the body, and it's like very bad allergic reaction. He's just 9 years old, and he will not be taking any bitter capsules or anything. Can you suggest something like lifestyle wise or diet wise we can help him?
Basically, in this mast cell disorders or allergic reactions or the swollen tongue, eyelids, and this is anaphylactic shock, something like that. Is all these are somewhat related with the allergic manifestations. So when these conditions are there, the drug of choice at our place, the first one is the Brihat Haridra Kanda. We have a very beautiful drug combination, Brihat Haridra Kanda, that can be even given to the young children because the taste is not so bad and can be mixed with. But thing is, what is causing the allergic reaction, that has to be tackled first. We need to identify whichever the foreign protein is causing this one, or whichever the thing, whether it may be milk protein or any animal protein or anything like that. We need to try to identify that part first and then divide that from the system. So if we could able to do that one, then definitely it will be beneficial. Then for the part of the treatment is that two important things are there. One is Kadirarista and Vidangarista combination plus Brihadaritra Kanda would be good for this. But Kadirarista Vidangarista combination, that boy, because the taste is bad, I don't know whether he'll going to take it or not. If it is taken, then it is good. Kadirarista and Vidangarista, 10 ml each, 3 times a day after food with equal quantity of water. That is always good. Then Brihadaritra Kanda twice a day with hot water, or if it doesn't have any problem with the milk and you don't have issues with the protein milk, then you can go with the milk. So this is what usually, and it continuously, if it is taken, then slowly that mast cell reactions will settle down, and you'll have a less number of episodes or less weaker episodes in future.
Are there any like tablet like instead of the aristas?
No, we can't replace the aristas with any other such type of things. But only thing is Haridra Kandam is available in the form of granule, which can be taken. And still, if you want, Haridra Kandam is also available in the form of tablet.
For a 9-year-old, 10 ml each of these Kadiras and Vidangarista, will not be a little higher dose, like 3 times a day?
Because he is suffering from a disease which is much stronger. Rogabala is more. We need to have to analyze those things because he is having a swollen tongue, swollen eyelids and everything. So it's a stronger disease. Reactions are coming with a strong dose, then they need to give certain proper dosage. Otherwise, if we are giving the medicine, the results will not be there.
Any mild virechna to be done, sir?
It can be done, but may not be much useful.
Okay.
Only when there is a itching will be there. It may be slightly a little bit itching will be reduced with the virechana. Regarding swelling part, also a little bit there is a reduction in the swelling, but I don't think so. Will not going to help you in any way.
To give aristas, I wasn't sure about whether I can give it to a child.
Once the child is more than 6 to 7 years, you can start using it. Because first the asava arista what we use is usually Arvinda asava. That can be given in children. Then from 9 years, then definitely we can give it Kadirarista and Vidangarista. And this is Kadirarista and Vidangarista usually given the combination where there is intestinal even some infestations are there, worms, that also can trigger the IgE reaction and these allergic reactions. So that is also a possibility. Mast cell stabilization needs to be done, and that will be done by Haridra.
Okay, thank you, sir.